The following video is intended to give private practitioners a brief introduction to home-based telehealth. We will start with an introduction to telehealth, review the current uses of home-based telehealth, introduce the equipment and software required for telehealth, go over how to schedule home-based telehealth appointments, and briefly review how clinicians and providers can give feedback to the telehealth program. Telehealth is meant to simulate an in-person visit with your patient through use of video conferencing. Cisco Jabber is the software that is used, and calls occur in a closed, secure network. Home-based telehealth is client-focused and is one of the provincial goals outlined in the Way Forward document. Within the regional health authorities, there are currently over 110 telehealth sites provincially, including various healthcare centers, clinics, and hospitals. With the new private practice initiative, telehealth has expanded to private practices and into patients' homes. Telehealth is delivered via secure live video. Because we are bound in the healthcare system by the Personal Health Information Act, we have privacy measures in place, such as encrypted network, firewalls, and password-protected software. There are two basic ways that we are able to connect using video. Physical telehealth devices located at healthcare sites and private practice clinics. Examples include portable clinical carts, desktop units, and wall-mounted options for larger spaces. We also have encrypted software called Jabber. This can be accessed from a corporate computer or personal device, such as a mobile phone, tablet, and laptop. We are now also able to connect into patients' homes using physical endpoints such as Jabber software and another web-based solution. Home-based telehealth allows the patient to attend a clinical appointment from the comfort of their own home or outside the regional health authority facilities. This service delivery option offers increased access to healthcare resources and reduces travel costs that may be associated with face-to-face clinics, training, and education. Some of the things to consider before starting to practice home-based telehealth are joining your call from a space that ensures the privacy and confidentiality of the patient. All providers should review the considerations for providing virtual care document that was sent in the welcome email. This document outlines privacy and consent items related to home-based telehealth. You should also identify the technical support that you may need prior to your call. Make sure you are aware of the processes involved in setting up the home-based appointment. For example, will you be scheduling your own appointments? Or do you have an administrative support staff member that can assist you with this process? Finally, you may also want to consider if anyone else in your office or area will need an orientation to telehealth. Please share this video with anyone at your practice that may benefit from orientation to home-based telehealth. There is an online request form for providers to submit a request for a Jabber license and account. Jabber is the secure, encrypted software that is downloaded on the device that you will be using for telehealth. If you are in a private practice or are working from home, Jabber is downloadable using a link for laptops and PCs or in the App Store for tablets and phones. The welcome email that you receive from the telehealth program will advise you to download Jabber on your device. It will also include a Jabber user guide and links to the Jabber training videos. These videos are also available on the NLCHI Virtual Care website. Once you review these videos, if you feel comfortable in your ability to use Jabber, you can email info.telehealth@nlchi.nl.ca as seen in the top right corner of the screen. If you watch the videos and feel that you need more training, please reach out to our team and request a virtual training session. Home-based telehealth can be used for individual appointments, such as one-to-one patient appointments, or healthcare provider consultations, as well as for group sessions, such as treatment or education groups. The steps for completing a home-based telehealth call are outlined here. First, you will need to submit the appointment request using the online form. Next, you will receive an appointment notification email with the dialing information for the call. At the time of the appointment, you will enter the call using the Jabber application. The patient clicks the Join In link in the appointment email to enter the call. WebRTC is a web-based platform that allows for the connection into the patient's home. When the patient clicks on the Join In link in the appointment email, they are joining the call via WebRTC or the web. Providers are able to enter the home-based call via the provider link. However, connecting via Jabber is recommended for a more consistent call quality. If the provider clicks on the link, as opposed to calling into the appointment via Jabber, they are entering the appointment via WebRTC. WebRTC can be accessed using selected browsers such as Google Chrome, Microsoft Edge, Firefox, and Safari. The patient connects to the telehealth call by opening their email notification and clicking on the Join In link. They can do this from the comfort of their own home, using their own device. The provider has a number of options to connect to a home-based telehealth call. The options are listed here. Jabber or WebRTC from a personal device, Jabber or WebRTC from a regional health authority computer, dedicated telehealth unit in a private practice clinic. There are some patients and clinical scenarios that are not well suited for home-based telehealth. Again, we encourage you to review the considerations document in the welcome email, which outlines patient selection and preparation, as well as privacy and consent items related to home-based telehealth. It is important to ensure that the patient is prepared to participate in the home-based telehealth call. In order to connect to a home-based telehealth call, the patient will need a device that is capable of video and audio. This could be a smartphone, tablet, or a computer with a webcam, microphone, and speakers. An internet connection that has sufficient bandwidth to complete a video call. They must use a supported browser when connecting to the call. The supported browsers include Google Chrome, Safari, Microsoft Edge, and Firefox. If all of this is in place prior to connecting for a live appointment, it is recommended that the client complete a quick speed test to ensure that their internet is capable of supporting a video call. There is a device check that can be done by the patient to ensure that their internet is capable of supporting a video call. The device check link is available in the Joining Your Call Quick Reference Guide for the patient and as a direct link on the NLCHI home-based telehealth website. The provider is not required to check their device. The Joining Your Call Quick Reference Guide should be sent to the patient by you or your administrative staff member prior to the first home-based telehealth appointment. This will allow the patient to test their device and know how to join their telehealth appointment. This document is located on the NLCHI Virtual Care website under Patient Resources. Once you have viewed this orientation video, reviewed the Jabber training and signed into Jabber, you will receive a final email with details on how to schedule your home-based telehealth appointments. To schedule a home-based telehealth appointment, click on the link provided and complete all fields of the online form. It is recommended that you submit appointment requests at least 48 hours prior to the appointment start time. This will allow adequate processing time for your request. An appointment request submitted 48 hours in advance is considered non-urgent. If you are not able to submit your appointment request 48 hours in advance, the appointment is considered urgent. To indicate that you require a more urgent appointment for your patient, select Urgent in the Appointment Information section of the online request form. Requests marked Urgent will be addressed as soon as possible. Once all fields of the form are filled, click Submit to send the appointment request. When the home-based telehealth appointment is scheduled, the patient and provider will receive an email notification. At the time of the appointment, the patient will click on the Join In link to join the call. The provider will enter the dialing information shown in the Provider section or Healthcare Professional section. They will enter this dialing information into the Jabber call bar. The provider can also click on the provider link to join the telehealth call. It is recommended that the provider use the Jabber application for a better quality telehealth call. At the bottom of this email, there is also a link to a survey where you can provide feedback after the call. If you would like to have a group treatment or education session, you can forward the email notification or link to all call participants. The participants will click on the link to join the call. If the Join In link in the email notification does not work due to a browser issue, participants can copy and paste the provider link into a supported browser to join the call. As mentioned previously, there are home-based resources for patients and providers on the NLCHI Virtual Care website, such as Joining Your Call for patients. There are also patient handouts about what home-based telehealth involves for patients considering this type of service delivery. The provider survey is located on the resources page discussed on the previous slide, and also at the bottom of the appointment notification email. Because home-based telehealth is a relatively new process, we want to ensure that the resources and processes developed are appropriate and effective. Please provide us feedback to help make this service better for patients and other providers. During this process, the patient and the healthcare provider may need additional support to ensure that they are ready for the telehealth call. If you or your patient are having difficulty during a telehealth call, please contact the technical support team. We realize that there are sometimes hurdles with adopting new processes and technology. The benefits of adopting home-based telehealth are significant. Please let the telehealth program know when you come across a hurdle or roadblock, and we will work together to find a solution. Please reach out to the telehealth program if you have any questions regarding this video. Thank you for your time.